Perfect. Thank you, everyone. So my name is Simba. I am one of the co-founders of Lenica Research Group, and our purpose as a company is to transform global mental health. The large-scale problem we are trying to solve is that by 2025, according to the World Health Organization, 1 in 3 people will be diagnosed by some form of a cognitive impairment. And if you happen to be one of the lucky ones that are not, it's almost certainly that you'll know someone who will be impacted by this, by some form of mental health impairment. And so to solve this, we have created a solution which primarily aims to offer a preventative way to prevent some of the mental health impairments that are going to be impacting individuals, in addition to supporting some of the prescriptive ways that are already available in our healthcare system. So peak cognition is a platform that on one end allows users and patients to train their cognitive skills, so their attention, processing speed, reaction time, hand-eye coordination, and decision-making accuracy, while also collecting the biometric data from a fitness tracker. So sleep, stress levels, heart rate variability, activity levels, and oxygen saturation, just to mention a few. What is unique about our solution is that there's a lot of research that our mental or cognitive health is impacted by a physical lifestyle, but there hasn't been a solution up until now that allows people to combine those two elements. We are planning for healthcare adoption as our primary focus, but because there's a lot of regulatory requirement, research, adoption requirements for us to get into there, we have created a healthcare adoption strategy. So initially, we are focusing on the sports performance industry. We are working with varsity teams and the Olympic athletes to help them optimize their performance so that they can outcompete their competitors. The next phase will be going into supporting recovery following brain injury. The reason behind this is that the sports industry and the healthcare industry both intersect at recovery following brain injury. So in sports, we'll be supporting sports psychologists and coaches around concussion management. And then in the healthcare system, we'll be supporting them with stroke management and other forms of brain injury. The market size, particularly around the sports injury, industry, is about 16 billion, and this is more specifically on the analytics size. The serviceable market that we can use, especially for the training component, is 900 million. To bring this on a granular level, the people that we are focusing on our market tend to be varsity sports teams, sports training organizations, and people that are seeking to become professional level athletes. So it's a much smaller market, and it tends to be focused in North America, but the opportunity to scale is pretty significant. How we make our money, we offer a solution both on an individual basis and for organizations. And this allows, if it's an organization, to be able to track and collect the data of their athletes or their patients and be able to monitor them remotely so that they don't even have to come in, which for COVID plays really well. We also have a markup on the hardware that we use. We are hardware agnostic. So any technology partnerships we have, we're able to make a little bit of money off there. And then we also offer custom bundles. Some of the validation that we've done is we've worked with Quantum Speed, which is a hockey training academy here in Edmonton. We are working with the UFA Pandas hockey team, and we've worked with other Olympic athletes, and some of them I couldn't include them here, but we are working with quite a few users at this point. And even though we've got 100 active users right now, we have 7 new organizations that just signed up to use our technology in the upcoming sports season. Our competitors, I figured I should have made this a little bit bigger because we have a lot more competitors than this, but I made it a little bit too small. But it's any organization that is focused on any form of cognitive training. So the 2 biggest differentiators is most of them work on your computer screen or on an iPad, which are like Luminosity, which you might be familiar with. And then there are a few competitors that also work in the virtual reality, augmented reality space. Some of them have some biometric integration, which they do where there's like pen and paper or surveys, but not to the extent that our solution is utilizing it. So our solution works in VR, augmented reality, as well as on a computer, and then allows full biometric integration within our ecosystem.
Simba, I can't see your competitor's screen. Could you go back one more time? Okay, we can see maybe 4 or 5 different logos on the graph. Can you go through it
Yes.
very briefly one more time?
Yes, so we've got Brain FX and Luminosity, which are kind of more the consumer version of the competitors. And then the ones that are a little bit more in our space is NeuroTrainer, which is a virtual reality-based cognitive training program, as well as NeuroTracker, which is a Montreal company that also has a VR-based cognitive training program. XR Health is the small one on top there, which is specifically in the healthcare space and works in stroke rehabilitation. And they have virtual reality lifestyle training programs that they do have. And so there is more that are going to the VR space. But again, the uniqueness here is that there isn't a lot of biometric integration associated with it, and to be able to glean insights from that cognitive health by combining some of the fitness data that we know contributes to how well a person is doing and their recovery process.
Thanks.
I'll make it bigger next time I come to present. So my name is Simba. My background is in psychology and neuroscience. We've got Dr. Yang Lu, who is a postdoc at the University of Alberta, and his expertise is in creating assessments and artificial intelligence. Our CTO is Eric Mang, who got a job to work for Google, but fortunately he decided to work for us. So our technology is beautiful. For those of you that are not tech, it's beautifully made. And then we've got our business development team with Scott and Cliff, as well as another developer, Jasper. And then Lenica is our stroke rehabilitation specialist. And we've got our advisory board, Dr. Singal and Dr. Boulanger from the University of Alberta. Our ask is pretty simple. We're looking for introductions from either the semi or professional sports teams to expand our use case. We are looking for research partners who are interested not only in validating our solution further, but if they're looking for a solution that allows them to measure the participants' biometrics, our solution is able to do that. And then for anyone who's looking to join an advisory board, we're a pretty fun team. We do work, but we also do have great discussions. And yeah, that's kind of our primary ask. And this is our team. I know we don't have a financial ask right now, and there's a reason behind that, which I can kind of answer. But this is our team. And if you have any more questions for us, I'll be more than happy to answer them. Thank you. Any questions?
Sure. Zach, are you there? Can't see you for the moment, but
Yeah.
are you there, Zachary? Ah, perfect.
Yeah.
Do you want to ask any questions?
Yeah, for sure. So how close are you to applying this in clinical situations? Have you done any testing on that sort, or is it strictly in the sports field as of now?
So we have worked with the Green Rose Rehabilitation Hospital to develop a prototype for stroke rehabilitation. But at this point, we have become more aware of the regulatory requirements, for us to be able to implement our technology in terms of the privacy security requirements, which our solution has already been pre-made for us to be able to do that within a month through MedStack, which is one of the technology companies which we have talked to partnering up with. So we can do that within a month, but there seems to be a lot more requirements to implement it into a clinical setting, not just in terms of the technology being effective and being meaningful, but it being able to work within the organizational context of AHS. So the reason why we're starting with the sports industry is that we can test, we can iterate, we can make sure that all the bells and whistles work, and we can show fit without requiring those, having to meet some of those requirements, so that when we end up transitioning into the clinical arena, we've got a lot of evidence to show that it actually works.
Great. Jeffrey Beanland, you have a question? Go ahead. We can't hear you yet. Jeffrey? You can also ask your question in the chat space, Jeffrey. Maybe I could just ask while Jeffrey's getting ready, Simba, just clarify what your ask is for today. What would be the most important thing for you to help with the next step of your development as a company?
I think for us, it's going to be introductions. So if anyone knows any sports training organizations, any varsity sports teams, if anyone knows the Oilers or the Flames, I know some of you might be from Calgary, so I'm going to add both of those. We're looking for introductions to some of these sports organizations so we can start doing a larger implementation of our solution. We finished our Startup Edmonton's Propel program, so we now understand that the marketing requires a little bit more comprehensive effort on our part in terms of identifying what customer segment we want to go into, who the end user is, who's the economic buyer is. So we're doing a lot of that validation right now with support from our beta innovates, which is why at this point we are not displaying a lot of like the traction that we're getting, because there's a lot of tests we're doing at this point to determine which market can we actually scale to, and are we willing to in the future look for additional funding. So that is just a matter of like, we know what we need to scale, we've got our marketing requirements, we have our partnership, it's just a matter of just turbocharging us on a global scale.
Thank you. Jeffrey, are you there? Can you ask your question? Jeffrey's in the UK, so his sound might not come through. Who knows? If not, Jeffrey, maybe if you could ask your question, Jeffrey, in the chat space. Zachary, maybe we should move on to Arun.